Here's something that might surprise you. Getting your hands on the newest COVID vaccine could require jumping through an unexpected bureaucratic hoop that hasn't existed for years. While updated COVID vaccines for the 2025 to 26 season are making their way onto pharmacy shelves across Georgia and beyond, there's a catch that's leaving many people scratching their heads. Unlike the streamlined process we've grown accustomed to over the past few years, you'll likely need to secure a doctor's prescription before rolling up your sleeve at your local drugstore. This unexpected twist stems from regulatory uncertainty surrounding how federal authorities are overseeing these latest vaccine formulations. The situation has created what many are calling an unnecessary barrier to public health protection, especially as COVID infection rates begin climbing once again in communities across Georgia. The prescription predicament, a temporary roadblock. Major pharmacy chains, including CVS with its extensive network of over 300 Georgia locations, along with numerous independent drugstores throughout the state, have implemented a prescription requirement as a precautionary measure. This represents a significant departure from the walk-in accessibility that characterized vaccine distribution during previous seasons. Dr. Jonathan Hamrick, who serves on the board of directors for the Georgia Pharmacy Association and brings years of experience teaching pharmacy law at Mercer University, while maintaining an active practice in Metro Atlanta, explains the situation clearly. Every individual seeking vaccination will require physician authorization until the Advisory Committee on Immunization Practices provides definitive guidance. This sentiment is echoed by Dr. Jonathan Marquess, an independent pharmacy owner who also holds the vice president position for the Academy of Independent Pharmacy within the state association. The consensus among pharmacy professionals is clear. They're playing it safe until federal recommendations become crystal clear. But here's where it gets controversial. The root of this prescription requirement lies in the dramatic shakeup of a crucial federal committee that typically guides vaccination policy nationwide. The Advisory Committee on Immunization Practices, commonly known by its acronym ACIP, traditionally serves as the authoritative voice on who should receive which vaccines and when. However, Robert F. Kennedy Jr., who now heads the Department of Health and Human Services, made waves in June when he dismissed all 17 existing committee members and handpicked 8 replacements, with 7 currently serving. This unprecedented move has sent shockwaves through the medical community and fundamentally altered how vaccine recommendations are developed. Professional medical organizations, including the prestigious American Academy of Pediatrics and the Infectious Diseases Society of America, have not remained silent about these changes. They've filed lawsuits and issued strong public criticism, arguing that these administrative changes threaten the scientific integrity of vaccine policy development. The September decision that could change everything. All attention now focuses on ACIP's upcoming meeting scheduled for September 18th to 19th in Atlanta. This gathering will determine whether Americans can return to the convenient, prescription-free vaccine access they've enjoyed in recent years, or whether additional barriers will remain in place. Under Georgia's current legal framework, pharmacists can administer vaccines that receive ACIP approval without requiring individual prescriptions, provided they maintain proper agreements with supervising physicians, arrangements that most established pharmacies already have in place. However, if the reconstituted committee decides to limit its recommendations to specific population segments rather than broad public access, the prescription requirement could become a permanent fixture. Dr. Hamrick emphasizes the uncertainty surrounding the committee's potential decision. We're all waiting to see how this unfolds, because the specifics of their recommendations will determine how different age groups and risk categories can access these vaccines. Rising infection rates add urgency to the situation. This bureaucratic uncertainty comes at a particularly concerning time for public health. Recent data from the Centers for Disease Control and Prevention reveals that COVID-related emergency room visits in Georgia have reached 1.6% of all visits, the highest level recorded since this same period last year. Additionally, wastewater monitoring systems, which serve as an early warning indicator for community transmission, show COVID levels escalating from very low readings in mid-July to moderate concentrations as of last week. These climbing infection rates underscore the importance of widespread vaccine accessibility, making the current prescription barrier particularly frustrating for public health advocates. And this is the part most people miss. The Food and Drug Administration has already given its stamp of approval to the latest vaccine formulation, but with notably more restrictive guidelines compared to the previous year's recommendations. This additional layer of limitation has created even more questions about who can access the vaccines and under what circumstances. For individuals determined to get vaccinated despite the prescription requirement, Dr. Marquis offers a practical solution. His pharmacy staff typically handles the administrative burden by placing quick calls to patients' healthcare providers to secure the necessary authorization, eliminating the need for time-consuming office visits. CVS representatives indicate that this physician outreach service availability varies by location. Some stores will make these calls on behalf of patients, while others require individuals to contact their doctors independently. Hashtag the financial reality. What you'll pay. For those paying out of pocket, the financial impact is substantial. CVS has announced that the updated COVID vaccine carries a price tag of approximately $225 per dose when purchased without insurance coverage. This cost represents a significant expense for families, particularly those with multiple members seeking vaccination. Insurance coverage remains another question mark in this evolving situation. Dr. Hamrick notes that while insurance companies historically cover vaccines that receive ACIP recommendations, the current regulatory uncertainty makes coverage predictions difficult. The committee's September decisions will likely influence whether insurance providers treat these vaccines as covered preventive care or subject them to different reimbursement rules. Alternative access points still available. Interestingly, not all vaccination locations are implementing the prescription requirement. County health departments across Georgia maintain different protocols under State Department of Public Health guidelines. Eric Jens, spokesperson for Georgia Department of Public Health, confirms that public health facilities can administer COVID vaccines without requiring prescriptions, as their nurses operate under established departmental protocols. However, these public health locations haven't yet received shipments of the updated vaccines. Each county health department places independent orders, typically based on demonstrated community need, according to Jens. The cost structure for uninsured individuals at these locations also remains undetermined. Political turmoil threatens scientific process. The situation has become even more complex due to significant upheaval within the CDC's leadership structure. Recent weeks have witnessed the removal of newly appointed Director Susan Monarez and the resignation of 4 senior officials who cited political interference in vaccine decision-making processes as their reason for departure. This administrative chaos has prompted even some political allies of the current administration to express concern. U.S. Senator Bill Cassidy, a Louisiana Republican who provided the decisive vote to confirm Kennedy's appointment as HHS Secretary, has now called for ACIP to indefinitely postpone its September meeting. Cassidy's statement raises serious questions about the committee's legitimacy. Serious allegations have been made about the meeting agenda, membership, and lack of scientific process being followed. If the meeting proceeds, any recommendations made should be rejected as lacking legitimacy, given the seriousness of the allegations and the current turmoil in CDC leadership. A potential legal workaround. Despite the current prescription requirements, Greg Raybould, who serves as general counsel and Vice President of Public Policy for the American Pharmacy Cooperative, suggests that Georgia pharmacists may have legal authority to provide vaccines without individual prescriptions under Georgia law pursuant to vaccine protocol agreements. This legal interpretation could potentially bypass the current restrictions, though it remains unclear whether individual pharmacies will choose to exercise this option given the regulatory uncertainty. The bigger picture, politics versus public health. Perhaps most troubling to healthcare professionals is how political considerations have become intertwined with what should be straightforward public health decisions. Dr. Hamrick expresses a sentiment shared by many in the medical community. We have to separate healthcare from political maneuvering. The stark reality of vaccine effectiveness remains unchanged despite the political noise. Dr. Hamrick emphasizes the proven benefits: fewer outbreaks, reduced severe complications, decreased hospitalizations, and lower death rates. Vaccines maintain population health over the long term. Yet the data tells a concerning story about vaccine uptake. During the most recent COVID season, spanning fall 2024 through spring 2025, only approximately 16% of Georgia adults received at least one COVID vaccination, a remarkably low rate that public health experts find deeply troubling. What this means for you right now. If you're planning to get the updated COVID vaccine in the coming weeks, here's what you need to know. Contact your doctor's office to request a prescription before heading to the pharmacy. Many pharmacies are willing to help streamline this process by calling your healthcare provider directly, though this service isn't guaranteed at every location. For those preferring to avoid the prescription hassle entirely, keep an eye on your local county health department's vaccine availability, though supplies may be limited initially. Most importantly, don't let the bureaucratic complications discourage you from seeking protection, especially as infection rates continue their upward trajectory. The question everyone should be asking. Here's what I find most concerning about this entire situation. Are we allowing political maneuvering to override scientific evidence and public health best practices? When regulatory uncertainty creates barriers to proven preventive health care, who really benefits? The September ACIP meeting will reveal whether evidence-based medicine or political ideology wins the day. But perhaps the more important question is this: should life-saving vaccines ever require navigating political controversies just to reach people's arms? What do you think? Are these additional hoops justified as careful oversight, or do they represent dangerous political interference in public health? Have you experienced confusion or frustration trying to access healthcare because of changing regulations? Share your thoughts and experiences. This affects all of us, and your voice matters in this critical discussion about the future of vaccine accessibility.